All right, well, I'll go ahead and get going with the introduction. Thank you all so much for coming here today. I'm Amanda Althouse. I'm a faculty member in Biostatistics and Informatics and one of our representatives to Faculty Senate. Faculty Senate and the School of Public Health is co-sponsoring today's seminar with Piper, and we're happy to do that. So many of you might have noticed the Be the One campaign, the pinwheels that were in front of Building 500's West Wing for the month of April until Friday afternoon. And so, in addition to participating in the Be the One campaign, we wanted to partner and present this seminar. So we're very happy to do that. And so it's with great pleasure that I'm introducing Dr. Des Runyon. He's a Jack and Vicki Thompson Professor of Pediatrics here at the University of Colorado. Some of his history, he's board certified in pediatrics and preventive medicine, and he holds an MD and PhD degree, MD and MPH degree in pediatric residency, all from University of Minnesota. And he was recruited to the University of Colorado in 2011 to become the executive director of the Kemp Center for Prevention and Treatment of Child Abuse and Neglect, which is an internationally renowned center on our own campus. So he was recruited from North Carolina, so he's a fellow Tar Heel. So I'm very happy about that as well. During his over 30 years at North Carolina, he was a professor in departments of social medicine, pediatrics, and epidemiology, and has led a 20-year longitudinal study of child abuse and neglect called the Long Scan Study, and a statewide intervention and evaluation aimed at preventing shaken baby syndrome in North Carolina, as well as international studies of child discipline. And while at the University of North Carolina, from their School of Public Health, he earned a DRPH in maternal and child health epidemiology, and also completed the Robert Wood Johnson Clinical Scholars Fellowship at UNC, and is now a National Program Director of the Robert Wood Johnson Clinical Scholars Program. So bringing more than 3 decades of clinical research and teaching experience about child abuse and neglect, we welcome Des Runyon today, and he will be talking with us about basic definitions, epidemiology, and approaches to child abuse from a public health perspective. So thank you very much.
So, thank you for the nice introduction. I'm happy to take questions along the way. I have a set of slides, but I came from a department in North Carolina where no speaker ever got through all their slides because they were interrupted constantly and questions were asked, and that was kind of a culture of the place. And I'm perfectly comfortable with going in that direction if that's what people want. So along the way, if you want to fight with me, argue with, etc. And the other thing I was just thinking about in the context of putting this talk together is I don't have a lot of data on outcomes from child abuse, but let me tell you that I have been doing a 20-year longitudinal study on child abuse and neglect, and that most of everything that the rest of you in this room talk about in terms of suicide, heart disease, lung disease, GI disease, has strong associations with adverse childhood experiences and particularly child abuse and domestic violence issues. And so there almost is no area within public health that doesn't kind of brush against and come up against issues of violence and child abuse. And so I certainly invite questions along that line as we get through into this. But I thought I'd start off with just a little bit of the role of public health in terms of assessment. So just a few, let's see if I can get this to go. Okay. So just a background, how many of you knew that intimate partner violence has declined by 63% or by 60.3% since 1993? I see one person. Isn't that 2 people? Carol knew, I know. Isn't that remarkable that we could have had a 60% reduction in a problem like the public problem that gets lots of attention like this, and that we're not hearing about it from every place? Do you think the American Cancer Society would fail to tell you about a 63% reduction in cancer? But what's even more remarkable about this from the standpoint of kids is that witnessing domestic violence is very tough on kids. In fact, in our data, which I'll come to, it actually may have more impact on young children in the 6 to 8-year-old group than either physical abuse or sexual abuse. So when you decline this, you actually may be helping children who are more than many of the other efforts we're doing. So I think it's probably worth asking yourselves, how come we don't know about this? When Carol was running a program called Prevent, which was teaching teams about prevention of violence and child abuse, and she had some groups of domestic violence people came in, and one time I stood up and asked them what they were doing right, how did they get this reduction, how could we do this in child abuse, because they were clearly hitting it out of the ballpark compared to what we were doing, and they said, we don't believe the data. And I said, well, we can have an interesting discussion about the data. It comes from the National Crime Victims Survey. It's anonymous. It's repeated. It's been doing the same kind of data collection for a long time. It's hard to figure out how that would be so terribly biased, but we could talk about that. He said, and then they added, and if it was true, we wouldn't want to tell anybody about it anyway because they'd stop giving us money, which I think is the other piece of it. That isn't the only thing that's gotten better. Here's the homicide data for the United States, and you can see that 1993 was also a peak for rates of homicide, and that's gotten better. And U.S. divorce rates, which went up dramatically in the 60s and 70s, also have been coming down since 1993. They've been coming down since before that, but there's positive trends. So all of you have been worried that the world is going to hell in a handbasket. Maybe it isn't going quite so fast, because there are some positive trends. These are the data for child abuse and neglect, and I guess, I don't know if, does this have a pointer? Maybe it does. I'll probably put somebody's eye out. But let me just say, the red is neglect, so that hasn't been much change in terms of child neglect. The rate's going up. But physical abuse has gone from about 38 per 100,000 kids down per 10,000 kids, down to a much smaller number, less than half of that range. And sexual abuse has also declined in these years. So there was a peak in 1993, and then it's really been getting better since then. So people have been wrestling with kind of what the hell is going on here. Why are we getting so much better? And I suspect all of you have heard of Robert Putnam's book and talking about social capital and kind of social networks and connections back and forth. And several people in this room have committed their lives to spending a large amount of time working on social capital. But the thesis of this book by Robert Putnam, which includes some of our data on, actually, my son was reading it in college and came home and said, "Dad, I found you quoted the book," which was probably the high spot of his college career. His dad had known something that somebody else thought was useful. But the argument of this book is that people have stopped participating in leagues, in bowling leagues. They've stopped participating in other civic meetings, parent-teacher associations, other things in great numbers, and that we're having a decline of social capital. And his metaphor is that more people are bowling than ever before, but they're doing it alone and not in leagues. But his thesis is that all the social capital and connections have gone away, and yet it's hard to argue that homicide, domestic violence, child abuse have all gotten better. And so why are those rates all changing? What's going on there? It's a little hard to figure out exactly where all of those things are. One of my theses actually is that social capital is being measured the wrong way. That we relied in the old days on looking at the kinds of things that women who were the caregivers at home and not working in the workplace were doing, like going to parent-teacher association meetings or League of Women Voter meetings, other kinds of things. And that our social networks have changed. And that our social networks are now more about work and the places of employment and professional organizations. And that for many of us, our social networks actually aren't in our city as much as they are at our national meetings and our colleagues around the country. And so that maybe the way that we're measuring social capital is wrong, not that social capital has declined. So all this is a long way of introducing the idea that culture determines kind of how we rear our children, what we do. Culture is defined by one of my colleagues in Chapel Hill as society's shared fund of ideas, beliefs, and behaviors about social conduct. It's a negotiable template for daily life, and among other things, it tells parents kind of how they should rear their children, what's okay and what's not okay, and defines unacceptable acts. So, for example, in North Carolina, you'd ask the question, how many of you were sent out to pick a switch in the yard and brought it back in and were hit with the switch as your childhood punishment? And maybe if people don't mind asking, how many of you happened here? Had that happen to you when you were a child? Anybody? It's virtually about 70% of the medical students that I deal with in North Carolina who are from North Carolina would tell you that story, that they had been sent out to pick up the switch. And one of my cases that I dealt with in our child abuse clinic was a kid whose family came down from New York to the South, and he was reported to the school system because he had switch marks all up and down his legs, big, large red bruises up and down his legs. And he was wearing short pants because it was warm in the South, and the teacher saw all these bruises up and down his legs and called social services. And the mother was devastated. She said, That's how my neighbors told me I should be disciplining my child. They send him out to the yard to pick the switch and then bring him back and hit him with the switch. But the difference is that her kid came from New York. He didn't know what kind of switch to pick. And so he picked a big stick because he didn't know that there's a whole art to picking the switch. And the mother had never done this before. She was talking on verbal instructions, had never seen it done to anybody else, and hit the kid rather harder than she probably should have, using a switch that was quite different from what most of the kids knew. And the kids talk to each other, and they're social capital. They know what switches to pick and talk to each other. And so the older siblings pass on to younger siblings. So it's kind of this negotiable template. We surveyed back in 2003, or actually it was 2002, and reported in 2003, kind of what people did to discipline their children. And we're actually hoping to start in the next week or so a survey like this in Colorado. It turns out 85% of parents take privileges away from their kids to punish them in our random digital anonymous telephone survey. 79% use timeout. 25% of the parents have lied to us and told us they didn't yell at their kids. 45% of the kids who are getting spanked, which parenthetically was the first survey ever done in the United States that showed less than a 50% spanking rate. But that may be confounded by child age compared to the other surveys, because I'll show you later some data on that. 25%, yes? We had a 52% response rate. And we had people, really? You're calling up and asking me about how I did that? And we gave them my number, and they'd call me up. But most of the calls I got were for people that wanted the data from parents. They wanted to know normatively what they should be doing. So spanking with an object, hitting with a belt or a stick on the buttocks was 25%. Slapping on the face was pretty uncommon at 6%. And pinching was about 6%. For the stuff that we called child abuse or abusive or harsh punishment, and what Henry Kemp would have called extended battered child, was 4.3%. Most of that made up with hitting a child with an object someplace other than their buttocks. But we also included shaking a kid under age 2, beating a child up, fortunately it wasn't very common, burning a child, and kicking a child. We also would have included threatening a child with a knife or a gun, but fortunately nobody did that. Yes?
So is this data broken down by race and ethnicity as well?
Yeah, and interestingly enough, it didn't dramatically differ. It actually was more difference by education than it was by race or ethnicity. So just to go back a little bit, there's a psychohistorian named Lloyd Demouse who wrote a book on the history of child rearing and talked about kind of the evolution of where we got to where we are today. And I was reminded of this shortly after I got to Colorado, and one of the people at the Kemp Foundation sent me to talk on a Christian radio station. I didn't actually know it was a Christian radio station. They sent me to talk on a radio station and we got into a discussion about spanking. And he said, well, spare the rod, spoil the child. And I said, I thought that this was rather, that there were better ways to rear children. And they said, well, but the Bible says that's the way to do it. And I said, well, but the context is the Bible said it thousands of years ago when most children were being put to death or being abandoned by their parents. And this was pretty avant-garde child rearing knowledge more than 2,000 years ago. If you just hit them, they didn't die, and they weren't thrown away. And the response that came back was, don't you think the Bible stands for all time? And I said, well, I would think that the Bible would have spoken to the people that it was written for at the time as well, and that was quite different. But you can see that there's this does get into issues of religion and how you deal with folks. But in antiquity, Lloyd Demouse argued that infanticide was the most common way of dealing with children. That by the 5th century, we'd become uncomfortable with that, but we didn't know how to do any better, so we just abandoned our children instead. But even before that, the abandonment of Moses and the bulrushes, the founding of Rome by Remus and Romulus, that children were kind of left and exposed. And in fact, the first children's hospital was founded in Rome by a pope who was concerned about children being just thrown away into trash heaps and dumped into the sewers, and that was to rescue children that were being abandoned. That by the 14th century, we'd become ambivalent with that as well, but we didn't have a lot of child rearing knowledge. Remember, the child development was a little later science, and parents had relatively short lifespans and such that they didn't have lots of grandparenting knowledge, and there wasn't an accumulated wisdom about how to care for children. There were, however, some midwives and a few physicians who started writing about how to rear children in that time, and they talked about how to wrap their arms and legs to give them a pleasing shape, and how to swaddle them so they could be thrown back and forth. So it was a kind of an ambivalent time period. The 18th century was Oliver Twist and beating the dickens out of children. The idea that children could be sent out to beg, and you would maim children to make them look more pitiful so they'd be more successful at begging. The 19th century, with the Industrial Revolution, you could send children to the workplace and they could make glass, or they could work in coal mines, or they could do other kinds of work and bring in income for the family. And it wasn't, Lloyd Demouse would argue, until the 20th century that we really got concerned about child welfare and child well-being. So both Plato and Aristotle actually supported infanticide, and in ancient Greece there was the Council of Elders would examine children, and the ones that were deformed or weak were judged not to be of sufficient warrior status, and they would weaken the society, and so they were killed. In fact, the Roman law of 12 tables actually forbade the raising of deformed children. And then you've probably all heard of the biblical story of the slaughter of the innocents at the time of the birth of Christ. And here's an Abraham and Isaac front piece from a Bible. And the fact that a parent was willing to sacrifice a child for the Lord was both a sign of religious fervor, but also just in a different time. You can imagine what we'd say today if someone said that's what they were doing. And deformed children. So I mentioned Rome and Moses and the founding hospitals, and then there was it has some things going for it. The idea that when you have your kid, you can send them out to be wet nursed in the country. They can come back for a couple of years. So you only have to put up for a few years, and then you apprentice them out for employment. And you only had to cope with kids for a relatively few years. There was early advice about how to pick a wet nurse. Redheads were out because they would. The milk was too far, and the kid's temperament would be wrong if you had your kid wet nursed by a redhead. So that there are a few redheads in the audience. I just thought this is not a job opportunity for you. But then they would come back, and part of the problem was that the wet nurses could make lots more money if the kids died in their care and they didn't tell anybody, and they would just keep getting the money. The remittances sent from the city, and then you could just tell the parents when they came to collect the kid when the kid was 2 or 3 that the kid had died, and you'd have gotten all the money in between. So unscrupulous wet nurses would make a living taking care of these kids or not taking care of kids that had died. So it was quite the operation. And then when they finished the wet nursing, they came home for a few years, and then by 7 or 8, you could apprentice them out to like chimney sweeps because they were small enough to climb up and down chimneys. And the chimney sweeps had their own individual problems. The epidemiologists in here will remember Pott's disease, cancer of the scrotum from carbon black that's engraved in their skin because they never got cleaned up. So cancer of the scrotum, actually Pott's disease is spine TB, but Pott described cancer of the scrotum. And then these kids and there were stories of kids who were apprentices dying trapped in fireplaces, and people that owned the fireplaces in the houses thinking it was amusing to set a fire when the kid was up in the middle of it cleaning it out. So it was a tough time. And there were kids that were sent out to the street to get alcohol and money for their parents by begging. The street Arabs and gutter snipes were terms that used in literature at the time. The ambivalent mode, this is actually one of I think Louis the Sun King, when he was an infant. But the idea of swaddling clothes, and we've talked about swaddling of babies now. We certainly know that babies quiet down when they're swaddled. But they also, if you swaddle them tight enough, and you can hang them up on a hook all day, and you can also keep the odors and liquids from emanating from them for a long time. Intrusive mode of beating up on kids. Here's an English woolen mill, a drawing of parents coming in and chastising a child who had been put to work in the woolen mills. And I gave you the Proverbs. It's often used to justify why you should be hitting your kids instead of doing some of that avant-garde stuff like time out or taking privileges away. In the socializing mode, I suspect most or all of you have heard of the famous Triangle Fire in 1911 in New York, where I think it was 111 girls and women died in a fire. They weren't?
A few more than that.
A few more than that? But women and girls that were jumping out of the building that now is an administration building for NYU in the Lower East Side. And it wasn't until 1904 that the National Child Labor Committee was founded, and it wasn't until the Depression when children were kind of excluded from the workplace with the Fair Practices Labor Act. probably not so benevolently for children, but probably to put adults back to work by not having their jobs displaced by children. And we developed a kindergarten, and then here in 1962, on a nice warm July 7th of 1962, when Henry Kemp published a paper called The Battered Child Syndrome. So Henry said, years later, he said, I coined the term the battered child syndrome in 1962 despite its provocative and anger-producing nature. I had for the preceding 10 years talked about child abuse, non-accidental or inflicted injury, but few paid attention. And interestingly, as a report, I don't know why he used Children's Hospital Pittsburgh for his data, since he was here in Denver, but Don may know. It was Betty Elmer that got, but he talked about how he summarized the cases that they had at the hospital and showed that the things that pediatric residents all learn are the most common childhood diseases, leukemia and Wilms tumor and neuroblastoma and cystic fibrosis, paled in comparison to the numbers for abuse and neglect. And yet, I'd say even 20 years later, when I was a resident, or somewhere in there, 7 years later, the usual childhood diseases were, I thought the most serious and most common childhood diseases were cystic fibrosis and leukemia and other cancers, because that's what we got taught and saw all the time. And Kemp actually said, and I'll go through this because it's kind of a nice note for prevention, if we discontinue tonsillectomies and open the resultant vacant beds to the baby whose growth and weight curves are flat for no particular reason, who does not smile or develop motor or social skills appropriately, we would gain tremendously in terms of preventing long and often irreversible pathology and lasting human emotional and physical economic loss. Testing for phenylketonuria is less urgent, and the yield is much less impressive. And he also said, and he's wrong, he said, nobody knows the true incident of the extended syndrome. That's what he called the rest of child abuse besides the battered child syndrome. But from perspective observations of families from all walks of life, I believe it is as common as 6 in 1,000. How about try 6 in 100? You might be closer to it. I think he was off by a factor of 10. And he also observed in the diagnostic process, we have a long-standing love affair with the detective story to find, and the temptation is certainly large for the physician to decide who the culprit is. In fact, I see much time wasted in trying to find out who did it. It's now clear to us that the important question for the physician to answer is, did something happen? And the other thing that he talked about was a little bit of the trauma that we get by taking care of the kids ourselves. He said he lists the vicarious trauma of the person taking care of the child as another trauma that needed to be attended to. And people are debilitated by the event. And he also had some observations about the dynamics, which I think we know it's a much more complex picture than that. He said, for every battering parent, mother or father, there's a spouse who abets, condones, and covers up the battering. Marriage partners tend to be very protective of each other. And certainly while we see all of that, we also know that work here in Denver was done showing that the allegations that came up in the context of divorce and separation issues were 85% correct. In a sense, so it wasn't just that people were using it for other kinds of allegations. So my thesis has been, we've been tough on kids for an incredibly long time. The world population back in the year 0 AD was 170 million. So we actually have more people than that in the United States. I told you about the Roman Law of 12 tables and all the other things, but what I want to do is show you there's some controversy about Lloyd deMause. He argued that there's no evidence that really was all bad. He thought that they overstated the evidence on homicide and abandonment risk, and argued that the review of the historical text doesn't give much insight. So I want to show you some international data that I think might help us understand whether deMause could be right. In Egypt, and this was a survey that was done in the late 90s, 37% of the kids in the 4th grade reported being beaten or tied up by their parents. In South Korea, it was about 69 or about 7% of the 4th or 5th grade kids that reported severe violence. Kicking, biting, beating, biting, throwing, or threatening with a knife or a gun more than 2 times a month. So the threshold for what was severe violence includes a frequency of 2 or more times a month. And the parents, when they were asked, 67% said they had whipped, 45% said they'd hit, kicked, or beat their child. In Romania, a survey that I got as a pamphlet from the World Health Organization that didn't have a date, but I was writing my chapter in 2002, so it was done just a few years before that. They had surveyed parents, and 47% said they beat their children regularly, and 16% said they beat them with objects. And just 4.6% of children themselves reported severe and frequent abuse, such as hitting with an object, burning, or being deprived of food. There are two kind of public health issues there, one of which is children seem to underreport compared to what parents self-disclose. And it's important to ask kids, but they may actually not have a comparison factor to know that this is abuse or abnormal. So that's an important piece of it. The other is that this was remarkably common in countries that didn't have this problem. I've told people about when I was in Egypt teaching clinical epidemiology. Carol and I went over in 1984, and I was teaching a course to grad students in Alexandria. And they asked me about my own research, and I started talking about child abuse. And I was told by a physician that child abuse didn't happen in Egypt. It was that they didn't have that problem there. And I think he said, over here we use our public health skills to look at important questions like schistosomiasis or rheumatic fever in a not so subtle put down. And fast forward a couple of years later, I was doing again. By the way, clinical epidemiology was defined by one of my colleagues as the ability to turn bullshit into airplane tickets. Because I was in Chile the next time. I was part of a conference talking about research methods in clinical epidemiology. And they asked me about my own work. And once again, I started talking about child abuse. And the Chilean physician interrupted me and said, no, that's not a problem here. We don't have child abuse in Chile. And I said, well, there's some data from a variety of countries. I think it's pretty worldwide. And he said, no, I can prove it's an American problem only. And I said, well, how would you prove that? He said, if you look in Medline, all the articles on child abuse come from the United States. So we got involved in a project called WorldSafe. We wanted to be pretentious. The World Survey of Abuse in the Family Environment. And through the Inclin network, we got people from 15 countries express an interest in doing it, and we got a total of 6 countries got funding to do a parallel survey. We examined factors related about violence of both against women and children, and a variety of risk factors for that. We ended up getting a total of 19 communities that participated, 14 of them in India, because the International Council on Research on Women gave a large grant to our Indian colleagues, and so they were able to get a lot, and the other 5 communities were much smaller groups because we found smaller amounts of money for the other places. But they included the United States, where we got a telephone survey of using the same questionnaire but by anonymous random digital telephone survey, and you saw some of the data from that. We also were able to get in Temuco, Chile, in Ismailia, Egypt, and in Philippines, middle of the Philippines. So we got, and Brazil. So for the rest of these slides on international, I've ordered them by maternal education. You'll see over on the far side, the most educated sample was Chennai, or the old city of Madras, and averaging 15.3 years of education for the women. At the other end of the spectrum, the rural Bhopal and the slums of Delhi averaged in Delhi was just under 2 years of education for the women in the sample. We asked 36 items about discipline. We used the parent-child conflict tactics scale, but then we worked with focus groups to see, are there other things that we should be asking about? Are there things that we shouldn't be asking about? Are there things we should take off the table or off the survey? And are there things that we should be doing? And it was interesting. The Indians said, well, you weren't asking about a major form of violence in the home. And we said, what was that? And that was mother-in-law against daughter-in-law. So we thought that was an interesting piece was added. They also, in India, said you're not asking about the discipline that happens when you tie the wrists together or tie the ankles together and hang the child, suspend the child either right side up or upside down off the floor. And after we got over our shock and we didn't exactly do poker faces, we kind of looked and said, really? They said, yeah, that's something that happens a lot over here. Well, we did a pilot survey. And it turns out it doesn't happen a lot over there. It's one of those things that everybody's kind of heard of and thinks they know about, but it turned out it was an example of one of the problems that focus groups have, that you actually the salient thing that's kind of really dramatic may get more attention than it really deserves. But that was, so we added a few things. The pinching had been taken out of the conflict tactics scale initially from the original survey because they thought it didn't happen much in the United States, and rapping with the knuckles on the head and pulling hair. And then the other thing we tried to figure out is, in the United States we do timeout, but in other places they do things like having a child stand with holding weights in their arms while they're in pain, or kneeling in the hot sand or on sand to hurt their knees while they're doing it as punishment. And so we tried to figure out how to capture an item of that, and you'll see what we did. And then obviously we asked the usual stuff. And I'm going to pick the Indian just because it's so much data. I'll just show you, first of all, the other countries. And this is spanking, slapping, hitting with an object, or being beat up. And the green is the interesting one. And they're all interesting. The United States actually look pretty good on this metric, except for Egypt in terms of spanking. But as I said, this was the first survey that showed less than 50% of kids being spanked. But the Philippines was up over 75% being spanked. But in Egypt, 25% of the kids were being beaten up by in fact, when we first saw the data, I called up our colleague in Ismaili, Egypt, who'd done a community survey and said, we obviously didn't translate this into Arabic correctly. This can't be right. And her response was, no, it's right. And in fact, it's true. And she explained to me that in Egypt, a child misbehaving in public brings great shame on the family. And this is actually the upper income families that were doing this because they were the families that cared about that. And so it was very common. And the women were the ones that did the discipline. It wasn't the men. So that the mothers would do, and sometimes the kids were pretty big, so that beating them up was kind of the thing to do, as opposed to just giving them a swat. So she thought these were real data. Yes?
Could you elaborate on what beating them up means?
Hitting him over and over again with a closed fist is how the item was translated into Arabic. So it's a little harder to see that. Again, these Indian ones are ordered in the order of maternal education. So Chennai, the most educated, is over on the far side, and close to me is the slums of Delhi. The label didn't get on it, and rural Bhopal. It's hard to see an overall pattern here, other than the fact that there's a lot of spanking going on in a lot of different places, but a few communities that were a little bit low. But beating up, it looks like there's a general trend toward the lower income families having more beating up. Yes?
So if you consolidated all of these so that, for example, when they're spanking, they're not beating up or beating up an object, would that show the curve to be more clear? In other words, spanking is less good than hitting with an object or beating up.
I'll come back to that question. I've got some more a way we pulled it together. The other thing I should just add is slapping was slapping on the face or head. And so the other thing that was quite common, in fact, in most of these communities, slapping was more common than spanking. And that's true. Our overall summary data from India is that more kids get slapped on the face or head than get spanked. When I said that, we had this discussion with my social worker in my child abuse clinic, who one day just kind of casually mentioned that she would report to social services any family that had slapped their kid on the face or head. And I said to her, what if they were Indian? And she looked at me and she said, I don't make my calls by their kind of ethnic group or background. And we got in discussion. And then I said, well, they're both hitting the child to inflict pain. What's the difference? And she said, well, you might put out an eye or cause brain damage with the slapping. And I said, well, maybe, but think of all those Hollywood stars that have been slapped across the face all those different times. I mean, in our culture, slapping on the face is seen as a big insult, but in fact, it may actually not convey anything different than spanking. So slapping was more common than spanking in 11 of the 14 communities, and I mentioned the beating up. This is a summary slide of the harsh punishment altogether, in which I added together kicking, beating, hitting, all the kinds of things I showed you before. So in the United States, we had the 4.3% that I mentioned earlier. And you can see Chennai was a little bit above that. But remember, these are ordered in maternal education. And so overall, there's a very strong trend line. For lower education of women, more harsh punishment of kids. And I think that's a pretty strong relationship there. When we did this, we also asked a question about shaking of the child. And then we stratified the analysis to look at kids under 2. And you can see that Chennai doesn't shake kids under 2. They were down here at 0. This is North Carolina, North and South Carolina, and you get, so there are a few places, the trend line isn't quite as strong. There are other places that don't shake their kids. But there are some remarkable figures with over 60% of kids being shaken in rural Lucknow and in rural Bhopal. We've done another survey with a colleague in Bangladesh, and over 50% of the kids under 2 were shaken to discipline them. There is one case report in the Indian medical literature on shaken baby syndrome that reports on 2 cases. But there's not a lot of recognition of that. So my thesis here is that the international data might give us a picture to kind of decide whether Lloyd DeMouse was right in terms of the occurrence of all that harsh punishment around the world, and would argue that these data suggest that it's not too hard to believe that our patterns of really harsh discipline and being tough on kids make some sense in the context of what we see now. And I would, using the numbers we had from the countries on the far end of the spectrum here, let's go back to, in terms of the 40 and 35%, I think one could argue that maybe in antiquity more than 50% of children were physically abused. Not counting neglect, not counting abandonment, etc. And so if you were trying to put a 2,000-year time trend together, you could kind of suggest that we're down here now. And for most of human history, we've been dramatically higher than that, which kind of puts a different perspective on kind of where we've been and where we're going, if you take the 2,000-year lens as opposed to worrying about 1993 on. And so I think it's probably worth kind of reflecting how far we've come. And this slide has a big error on it. It attributes most of that decline kind of after 1500. I suspect that we could probably attribute most of that decline to after 1962 and Henry Kemp and the recognition of problem child abuse. It probably continued along at fairly high rates up until that point. So the other thing I was going to show you is in my continuing theme of what public health people ought to know is that we just recently conducted a survey of parents in North Carolina. We had a sample of 3,000. We did the same thing we did before, anonymous random digital telephone. The way we got the list this time is we got the State Center for Health Statistics to give us 24,000 birth certificates randomly sampled from the last 2 years. And then we went through and picked a random sample of those to be our random. We took the names and addresses, sent them to GenSys, and for 50 cents a successful match, they gave us a phone number. And so we got about 60% of the sample had phone numbers, and then we sampled among that group to get this. It was an anonymous telephone survey. We again used the conflict tactics scale. We had a 52% response rate again. Seems to be a theme here. But the interesting thing about this particular survey is that it takes a couple months for the birth certificates to get into the sample. So we didn't really have kids under 3 months when we first started sampling. But 6% of kids at the 3 month window when they first started sampling were already being spanked, which is a remarkable figure. I'm trying to figure out what lessons you would teach a child that young by spanking them. And that the Academy of Pediatrics actually recommends that we have the discipline discussion with parents and well-child check at about 9 months of age. I think that's kind of heading them off at the pass before they get too far along. But in fact, 25% of kids are already being spanked at the 9-month visit. That the T50 time to 50% for spanking is about 13 to 15 months. There are some ethnic differences. The Hispanic families spanked a little bit earlier than the non-Hispanic families, but we didn't find any black-white differences there. And in this survey, we actually didn't find any income differences, which surprised us a little bit.
Did you find any differences in education for the moms or dads who are spanking prior to?
Well, I've got a postdoc who's still torturing the data, but the interesting thing that she does, we asked about depression. And it looks like the 6% who are being spanked in the first 3 months, maternal depression is a strong predictor of which moms are doing them. That shows up as a really strong predictor. In fact, and the 25%, it's paternal depression, we don't know it, paternal, but maternal depression looks to be very important. Jennifer Keloff, who's a pediatrician that does child abuse pediatrics, but is over at Kaiser, and we've gotten into a project looking now at paternal depression, the newborn period, and seeing how that relates to this kind of issue as well. So what are the trends overall? There are a couple things that we had a little trouble sorting out how to compare and contrast the data that we have. In 1976, 1975, 1985, and 1995, national surveys with only a sample size of about 1,000 were done by Murray Strauss and Rich Gellis as part of National Family Violence Surveys. And then we did our survey in North and South Carolina in 2002, which was just 2 states. And the caveat here is that North and South Carolina were at the high end of the spectrum for the country in the earlier surveys. But they didn't have enough power to tell us exactly what that was because those were only 1,000 households in each of the 3 earlier surveys. And there were some issues in terms of how people categorize ages. So we ended up just teasing the data out in a data set, and we've published this. We looked at the 3 to 5-year-olds to see how they're being disciplined, and then the 6 to 8-year-olds. And 82% of the 3 to 5-year-olds are being spanked back in 75, and that hasn't declined very much. In our survey in North Carolina, it was 79%. But 6 to 8-year-olds, interestingly, had gone from 80% in the country in 75 and 81% in 85 down to in the 60s in 95 and 2002. So it looks like for older kids, there's a pretty dramatic decline in harsh punishment, at least in spanking. So that we may be making a difference there in terms of trends and attitudes.
Yes, do you know what they were doing instead of spanking?
Well, I gave the other data in terms of how often. In Murray's data, we looked at that, but I don't recall.
With the 6 to 8-year-olds.
I don't remember the timeout, taking privileges away, and yelling at kids, telling them to stop and start. I don't remember that there were any trends in terms of changes in that. It just looked like the one that was most dramatic was decrease in spanking. So what are the other explanations? I mean, some people have suggested, well, maybe it's poverty that's fixing all of this, and maybe we're no other societal change. But in fact, child poverty has gone up, and yet the trends have gone down. The other thing this slide shows is I put the domestic violence. The green line here is IPV female victims, and the bluish line here at the bottom is IPV male victims. And so male victims have gotten pretty small, but actually statistically they didn't decline nearly as much as domestic violence against women. There are some interesting implications of that from the public health standpoint, one of which is that proportionally a greater percentage of domestic violence victims are now men than there have ever been, because we've made probably a pretty dramatic decline in women, and the men rates haven't changed very much, and so that would suggest that our battered women's shelters and battered women's programs need to start thinking about kind of what are we going to do about the other victims that aren't being attended to. So in summary, I think that one could say that the international data suggests that the DeMaus psychohistorian data from antiquity probably aren't too far off. And that it's plausible that child abuse actually was modal in antiquity and has gotten much better. Public attention to child abuse is clearly can be tied to the work that Henry Kemp did here in Denver and the battered child syndrome. IPV decline is actually greater than and leads the decline in child abuse, but child abuse has been going down. We know from our longitudinal study on child abuse and neglect, when there's domestic violence in the home, there's a 44% increased risk of a child abuse report coming from that household in the next year. And so I did make myself very popular among my child abuse colleagues at the Chadwick conference last year when I suggested that we haven't been very effective in the child abuse prevention world in doing anything, that maybe all of the gains that we've seen in the decline can be attributed to our colleagues who are working in domestic violence. And the intimate partner violence decline could explain most, if not all, of the decline that we've seen in child abuse. It's less clear that other societal interventions have made a difference. We don't know if the campaigns for awareness, we do know that back when the Prevent Child Abuse, which used to be, John, remember what Prevent Child Abuse used to be before it was Prevent Child Abuse America?
National Committee for Prevention of Child Abuse.
They started doing surveys in the 70s in recognition of the problem of child abuse. And back then, in the 70s and 80s, a lot of people in the society didn't know about child abuse. But in starting in 1995, 96, and going on, child abuse is something that if you survey people and say, is child abuse a problem, but is that something we need to know about, it's well over 90%. And the question of how much, I mean, I'm not complaining about our pinwheel campaigns at all, because I think, but just recognition by itself is probably not sufficient. We need to do some work in terms of getting actually programs and policies in place to help protect kids. And so my attribution that what may be happening is that our domestic violence colleagues have really done the major heavy lifting on this is interesting. Why might they have been more successful? Well, I think IPV work has largely been done by activists. It's not a professional movement as much as an activist. The victims are adults who vote and talk and show up it's tied to the women's movement. There's been a lot of attention to the root causes and issues of violence in the home and kind of changing people's attitudes about gender relationships. There are angry victims who have the capacity to act. And CDC has really been paying attention to this in a longer way. In contrast, child abuse and neglect is something that's been largely driven by professionals. We have social workers, lawyers, psychologists, physicians, but it's largely a professional movement. David Chadwick, a colleague in California, would talk about the lack of authentic voices. We don't have, the kids who are victims of child abuse don't vote, and when they are voters, they don't talk about their child abuse. It's something that's put behind them. The other part of it is a major part of the problem is neglect, and that isn't nearly as dramatic as somebody who shows up in the emergency room with a broken jaw or knocked out teeth or bruises and bleeding. And so that, and the other final part is the lack of attention from NIH and very limited support from CDC. The NIH, and I just did this math the other day just to kind of prove my point. Muscular dystrophy is not exactly a big major problem. There are about 50,000 new incident cases a year of muscular dystrophy. They spent $79 million at the NIH on muscular dystrophy last year, which comes out to something on the order of $2,600 per case, a new case of muscular dystrophy in the United States. Muscular dystrophy, cystic fibrosis is another one that generates about the same burden and has about the same expenditure. So both of them are in the $2,600 per new case area in terms of funding. Child abuse and neglect last year, if you use substantiated cases only, is $18. And since substantiated cases are less than a third of it, it actually gets up to dramatically higher numbers if you just use dramatically lower numbers in terms of how much per case if you use the allegations and not the substantiated cases. So we have a national infrastructure that supports research that doesn't support this particular area, which I debated coming over and telling you about because I want you to work in this area. But I also have to be candid that if you spend your life working in this area, you're going to be working uphill to try and get funding for this all the time.
So to me, what you're saying in part does is power of civil rights movements versus public health movements. And 40% of writing in column is the same thing. It's the lack of power to influence, and children can't hold us accountable. And if you look at everything from abolition to prohibition to women's suffrage and all of the other civil rights developments, all of those have progressed because the people most affected had organized to do something about it. Interestingly enough, however, two very powerful, successful movements involve an interest that cannot speak for itself. The two I think of are the environmental movement and the animal rights movement. Historically, the animal rights movement has often done much better than children.
Although the animal rights is not probably being led by veterinarians, it's being led by activists in a similar kind of way. So
it's the identification, it's the interesting question.
Yeah. Right?
It's interesting also, as we look at the incidence or frequency, are there periods of the year when you may see more? We did a study back in about 76 or 79. What we found that there are two peak times during the year where we saw a new incidence of reporting unsubstantiation. And one was around Christmas and prior to Christmas. The other was when school ended, which are major shifts within our community. And I know working with elderly and disabled kids, I talk to parents, they pray for school to start. Because
the Christmas certainly is a big peak factor continuing in the United States for child abuse, but it's actually the start of school that gets a lot of folks referred because the teachers suddenly, I mean, the kids come back to school and the teachers see the injuries on the kids and see the bruises, and the kids have scrutiny that they did. There was no comparable surveillance during the summer. So there's a kind of a surveillance or detection bias that happens when school starts in the fall that results in a peak of investigation.
Which then says, as a public issue, how do we understand those cycles? And are things that we can intervene at times that we've got data, whether end of school or beginning. I think it's that same period. Kids are being seen by a variety of other players in the community, and maybe asking questions.
Well, I mean, the 2,000-year perspective suggests that we are making a difference. The microscopic, this year compared to last year, it seems like we're not making a big difference. There's a book called Scandalous Politics, The Politics of Child Abuse and Neglect, that uses Colorado in 1999 as an example with 3 other states and then a survey of states that makes the argument that basically what happens is child welfare scandals put this back on the television, front of the newspaper and people's attention for a relatively short period of time. So you have a year or two at most after a big scandal has shown up in the front of the paper, and you get a whole bunch of changes, and then it goes away and people forget about it. So I'm sure every one of you saw the Denver Post or the Channel 9 News series in November, and true to form, the legislature has had a bunch of bills and a bunch of attention to child abuse this time. And David Bowles is sitting in the back, and I are both somewhat the beneficiaries of that because they're talking about how to improve services, the Nurse Family Partnership or Safe Care, both things that are growing out of that, which is Nurse Family Partnership, as David can tell us, is a program for young mothers that starts before they actually deliver the baby and goes for a 2-year program for helping risk mothers, first-time mothers. And Safe Care is kind of bats cleanup in the sense that it's mothers reported to social services already for neglect who have a kid under 5 who then get a manualized educational curriculum for about 20 weeks afterwards. It's been shown to reduce recidivism back into the home. But both these things are, David's program is primary prevention. Safe Care is kind of primary prevention for the next one by getting a high-risk group at the best. It's basically secondary prevention. We really struggled to come up with a good primary prevention program outside what David has done to kind of change society. But the recognition that Henry got from putting that curve, if you go back here, if you put on this curve, it doesn't seem so. It seems like the cup is more than half full. We are making major changes, and we are doing recognition. We are solving it. Yes.
So do you know, are there any relatively recent data on deaths due to IPV fatalities?
I've seen numbers. I don't know. Does Carol, do you know, or is anybody here?
Yeah.
I don't have it in my head. Yeah. But it's a useful kind of anchoring point to think about that as well. And the advantage that adult women have is they're a lot bigger and it's a lot harder to do them in the same. Babies who get beat up, predominantly fatalities are kids under 2, and even under a year. So it's the homeostasis of the body is a lot stronger and better when you're an adult than you are when you're an infant. But it's worth tracking that down. Carol?
So public health departments deal with surveillance and with primary prevention. What should they do? If you were the czar of, health and human services, what would you tell them to do?
Well, I think there are two major roles. One is the surveillance and public attention that should go on, not just by the Channel 9 News and the Denver Post, but there should be an ongoing attention to this issue in the same way that we talk about flu epidemics, and we know how much bird flu there is, and in China we know how much chicken pox is going on in the community. There's lots of things that we know because public health is telling us, and yet these numbers are largely hidden, and people say we can't talk about cases. And so until Channel 9 News comes out and tells us 71 deaths of kids who've been reported to the system and 155 overall for the same period of time. Until that came out, we didn't know about that. But so ongoing public attention by looking at the numbers and reporting it would be a good place to start.
Also, WIC, in my opinion, WIC is the best federal program going. And those, in our clinic, we do a Failure to Thrive clinic in Jefferson County. And because the WIC educators have somebody to go to when they see parenting problems, we get lots more referrals. So just having somebody who's attentive to these issues in a public health setting and can talk to parents is one way to get people to talk about
Well,
stuff.
and I was going to add the piece that I think, the other piece that public health can do, we used to have public health nurses that were
Yes.
kind of there all the time, and we're kind of getting back, David's program and perinatal educators in the hospital, we're getting a little bit back to that. And I think public health has a role for people who are home visitors, and it's a whole different experience if you knock on the door and say, I'm from the health department, than if you knock on the door and say, I'm from the Department of Social Services. And you know, I'm from the government, I'm here to help you is not something that we all look and say, but people from the health department are people expect help from, whereas when social services comes, the first response is, I know who you guys are, you're the people that take kids away from parents. And so it's so actually if I were the czar of this, I would kind of assign, I'd take 25% of the social workers and move them to the police department, and give them police badges and let them do the investigations and with the badge. And I'd take the other 75 or maybe 80% and I'd move them to the health department, and I'd take foster care out of their hands in terms of ability to take kids away. And you had to go to the police side to get that done. And they would be there to help, and you'd find services and programs. That's my solution.
I'd just like to highlight that there are these community linkages that are represented by this whole paleo movement, much the same as community-based participatory research realm has taken hold and created these remarkable linkages that allow people to move forward and integrate into whatever their respective programs is. You know, I'm thinking WIC and public health, but there are also family resource centers. There are educational, preschool education groups, and they are a linking network in every community. They're just less and less focused on the ability to integrate child abuse information into what they do. But finding out those linkages, that web that Gary Milton talks about so specifically in his research, it is very powerful and it's sustainable. And that's the thing with a professionally dominant system versus a community-based system. There is a sustainability there that really can prove that change.
Yeah,
What about like Healthy Start and
well, that's an interesting question. And the Healthy Start people kind of started gangbusters, and we all got excited about them and with the home visiting. The data aren't quite so strong that it's making a big difference. It turns out Healthy Start does lots of good things. The mothers finish their high school education. They do more spacing between kids. A lot of the same things that happen with nurse-family partnership. But I think study after study has been disappointed by the lack of movement of the kids being reported to Child Protective Services. And so we have to think more about how to do that and do it better. Yes?
So I have two questions. In the beginning, you focused on 1993 as the point when several other measures were starting to drop, yet child abuse rates were not dropping. Is there anything that happened in 1993 that's causing the others to drop? And also, you defined reportable offenses, but then many of your slides focused on spanking and things that aren't reportable. Is there a definition of, are there reasons to reduce the amount of spanking to sort of change the climate in the home where you just don't, and you just approach parenting from a perspective? My focus on parenting.
So, briefly, in 1993, there was an economic expansion that happened over the 90s that appeared, plus I don't know what else, but I think rising tide lifted a lot of boats. And during the Clinton administration, that seemed like that may have made some difference. But the trend has continued into the early 2000s. It may have kind of tapered off in 2005, so it may not have continued unabated, but there was some improvement in terms of that. I'm sorry, your second.
And then, so we're sort of focusing on reducing reportable offenses. Many of your slides focused on spanking or hitting with an object those aren't really reportable. And you highlighted the story about North Carolina families who, so if that's acceptable, is that acceptable?
So this gets back to the core underlying principle of public health. Jeffrey Rose and kind of shifting the curve overall. We looked at the data. We used the people who hit their kids on the buttocks with an object, which was not reportable. 25% of parents did it. They were 9 times more likely to also kick, choke, beat up, etc. I actually think the battle on spanking is something that we may not find very productive, because lots of people are very defensive about spanking, and more than one parent has said to me, "I was spanked as a kid and I turned out fine," and that's true. But when you put it in the context of, but if you had a drug that you were giving people and it had a 4% bad outcome, you probably wouldn't accept that drug, but you're willing to accept spanking even though it may be a 4 or 5% bad outcome. But the 9-fold higher risk for abuse if you're hitting with an object may be that our public health efforts ought to be kind of changing how we discipline and making it so people no longer use an object and get told and that we change the culture about harsh punishment and just focus on and not fight the battle over spanking. No.
Do you have any research about how substance abuse and child abuse and neglect are, what the rates are with the substance abuse versus without the substance abuse?
I don't have current data. On an earlier survey we did were self-reports of both the harsh discipline and the self-report of drinking suggested a 9-fold higher difference for households that would have the alcohol use. There's probably other data that are better than that I just don't have on the tip of my tongue. But we clearly know alcohol is a risk factor, although not completely. Our Egyptian data, and it's a Muslim country, so alcohol is not there. And we could show that domestic violence was down dramatically in Egypt compared to other countries, by the way. And our Egyptian colleagues attributed that to lack of alcohol in the homes. But at the same time, the harsh punishment of kids was, 25% were beating up their kids, so it's not a complete one-to-one relationship. But I think every social service person who goes into homes will talk to about the meth and the other drugs that they see. But I think alcohol is the biggest drug of abuse that ends up in problems. We're probably at the end of our time, and people don't want to get into one. Is that the...
Yeah, I think we need to wrap up. I was just I looked up while you were answering the last question, 1994 O.J. Simpson. Which I wonder, the extent to which that has a role in the domestic violence.
Well, and we do know that shaking declined with the Matthew Eapen in Boston, the Boston Nanny case, that we could show a decline in parents telling us about shaking from between 95 and 2002. It dropped from 4.5% to 2.6%. And then Mark Diaz's paper came out in 2005, and most recent North Carolina data, we have only 0.5% of parents tell us they shook their kids. So there are some larger public things that are going on.
All right. Well, thank you very much. Just to inform you, there's another upcoming seminar in the paper series on May 20th. I guess it'll be in Ed 1, so in a different building, but put on your calendars. And let's give one final applause.